Good afternoon, everyone. I hope that you're doing well. My name is Mary Beth Carroll, and I'm the Assistant Director of Student Affairs within our Office for Student Engagement and Practice at the University of Michigan School of Public Health. I'm happy to have the opportunity to speak with some of our prospective students and hopefully some of our applicants this afternoon. It's one of my favorite parts of my job, and I really enjoy engaging with those who are interested in contributing to making the world a better place. My pronouns are she, her, and hers. So let's dive in here. The first part of the session will be more of a formal overview of the school and our application process and a little bit about the departments. And then afterwards, we'll have some of our current student admissions ambassadors talk a little bit about their experiences as well. In addition to that, I'm also joined by two admissions staff members, Joyce and Levi, and they will be answering questions via the chat along with some of our current student ambassadors. So this photo up on the screen here is of my daughter Vivian, and she's 3 years old. As you can see, she's definitely gotten used to wearing a mask by now. Her shirt says right there, choose happy, and she is happy, at least in this moment. I'm sure that most of you know that toddlers, young children can be unpredictable sometimes, and I think in many ways that is what sums up 2020. It's been a year, it's been a ride. I think we can all agree upon that. If you are, looking to join us for next fall or in the future, I briefly just want to touch on the COVID-19 pandemic and how the university as well as the school has gone through that process. That's probably something that you're wondering. So with that being said, I want you to know that from the onset of the pandemic, university and school leadership have made public health informed decisions to ensure that our students can continue to learn safely. We'll continue to keep the safety of our community at the forefront today, tomorrow, and for as long as the pandemic is with us. We certainly all hope that this is going to be a very exciting week with the vaccine approved and hopefully being distributed to different populations in the near future. So the staff and faculty here at the School of Public Health, we want our students to feel engaged, connected, and a sense of belonging within our community. And we certainly recognize that these are unprecedented times. It's important that our students know whether they're joining us in person or in a hybrid format or completely virtual, that they're being supported, whether they're near or far. When I speak to prospective students, one of the main advantages that I mention about our school are the countless opportunities, resources, and networking engagements that our current students have the opportunity to be a part of. We really encourage our students to take advantage of all of the different resources available, both at the school and university-wide. Today's session is going to be primarily geared towards our Masters of Public Health and our Masters of Health Services Administration prospective students. As mentioned, please feel free to put in the chat box if you have any questions throughout the session. In addition, I asked a prompting question there. Please feel free to share what department you're interested in and even where you're logging in from. So our first slide here addresses what is public health. Public health is defined as the science and art of preventing disease, prolonging life, and promoting physical health and efficiency through organized community efforts. And if you think about it, public health really is all around us. It's the quality of the air we breathe, it's the flu shot, or hopefully the COVID-19 vaccine that we'll be getting soon. It's the ethics of genetic testing, and it's even the policies that govern our healthcare system. If you hear about something in the news, it's likely that there is some type of a public health angle to it. Our common denominator here really is that everything we do in public health is about improving the health of people, but at a population and community level. Michigan Public Health is pursuing a healthier, more equitable world through education, research, and action. There's no specific undergraduate degree or set of professional work experience that you have to apply. However, there are some recommended and required experiences that we are looking for among applicants, and we'll talk about that a little bit later. In addition, if you have been looking at other graduate programs in public health, you'll notice that there are common themes where students are looking at specific departments kind of across the board. Some of them are more on the hard science end, while some are also on the social science end. One other thing that I will mention is that there is an opportunity to apply to multiple departments, so definitely keep that in mind. What you'll want to be cognizant of is if you're applying to different degree programs, there are different application systems that we use. So this slide here talks about Ann Arbor. If you haven't had the opportunity to engage with us, I would definitely encourage you to take a look at our university-wide website. When it is safe to do so, spend some time coming here and really do like what you're doing now and take the time to connect with current students, staff, and faculty to hear about what life is really like in Ann Arbor. You can see listed there some of the different accolades that we've gotten over time. The cost of living, I will say, is reasonable in comparison to probably some of the other schools that you're likely looking at on the West Coast or the East Coast. We have a lot of those same amenities available, but just on a smaller scale. One other thing I will mention is if you are connected to other places in the world or other places across the country, it is very easy to get in and out of the Ann Arbor area, as the Detroit Metropolitan Airport is about 30 minutes from campus. So this next slide talks a little bit more about the school. I think it's important that you have an idea of what your community could look like. In total, we have around 1,300 current public health students. Our population is made up of graduate residential as well as an online population, and we have some undergraduate students as well. In addition to that, we have around 170 faculty members. And if you are interested in research, we have over 30 research centers that you can get involved in as well. In addition to that, as you can see noted here, our faculty to student ratio is 9:1. And I think a lot of times when people think about the University of Michigan, they think of us as a large research university where they're just going to be a number and be lost among the shuffle. And we really strive to support our students from all angles. One of the positives of coming to a large research institution is having that layered support at the university level, the school level, and even within your department. So there are a lot of people along the way to ensure that you have a successful transition and that you have access to the resources that will help you be successful here. So this next slide talks a little bit about our degree offerings. So let's we have our master's degrees. Certainly, we have those under our professional focus. The first listed there being our Master's of Public Health, which we offer both online and residential. The online program takes place over about 5 semesters and is under 50 credits, whereas our MPH program that's residential based is designed to be completed in 2 years. So a little bit different there. Also within the residential program, again, you're focusing your degree within a specific department, whereas population and health sciences is more broad. Also listed under there is our Master's of Health Services Administration, which is similar to an MBA, and that program resides within our Health Management and Policy department. Under research focused, if that's something that you're interested in, we have our Master's of Science that's delivered residentially, and then also, as you can see, they're online as well. And then we do have PhD programs too. Those programs are administered by the department in conjunction with the Rackham Graduate School. So the application process is a little bit different. Over on the right-hand side there, you can see listed our dual degrees. The school has a series of formalized dual degrees, but also there are opportunities at the University of Michigan to participate in a self-initiated dual degree. One of the perks of coming to the University of Michigan is that interdisciplinary research is at the forefront of everything that we do. And built into your curriculum, you have the ability to learn from experts within other disciplines across the university. Whether you're electing to participate in a certificate program at the School of Public Health or one outside of the school, you're able to tailor your degree to exactly what you want it to be to get you to where you want to go. All of our schools, including the School of Public Health, are equipped with professionally trained career staff professionals who help get our students to where they want to go. We have an employer relations coordinator who partners with outside companies to recruit our students for their internship requirement, full-time employment, and it's a great database that you will have access to as a current student after you graduate and beyond. We call that a cradle to grave service. for our current students. But truly, our career staff do a lot of other things that are really remarkable and really helpful for our current students, including LinkedIn profile reviews. They do specific department programming. They even will do things where they'll visit some of the capstone courses within departments, and they'll have students submit their resumes, and they'll review every single resume within those courses. In addition to that, if you're a second-year student and you have been applying for jobs and you get an offer for a job, they'll sit there and they'll help you negotiate that salary. So we are there working hand in hand in tandem with our current students to ensure that they get to where they want to be. And that's something that we're very proud of. So this next slide here talks a little bit more about some of the application requirements. I thought it would be important to include this piece as well. And I can briefly just touch on these different facets of the application. So again, our residential and online MPH and MHSA is administered through SOFIS, which is a CAS system, also known as a common application system, that allows you to apply to multiple schools of public health at one time. One thing you'll want to be mindful of is that all of our application requirements need to be submitted and vetted through SOFIS before we actually get them at Michigan Public Health. So you'll note that there are 2 required essays, the SOFIS statement of purpose and the reflective essay. Really, with both of these, we want to know, things outside of your grades. We want to hear your voice come through. We want to know your passion. We want to know why public health, why Michigan. Certainly, if you have an idea of where you want to go futuristically, that would be appropriate to include in one of these as well. Within the reflective essay, if there are concerns that you have in regards to your application, or if you've overcome an obstacle throughout your professional career or your undergraduate career, we want that to be there. I'll have Joyce and Levi put a link in the chat box right now so that you can review those prompts. They are listed on our website. So talking a little bit about the standardized test, hopefully if you are applying, you know that that has been removed as a requirement for this year. And this has been a pretty hot topic within higher ed pre-COVID-19, but I think that the pandemic has allowed us to really reflect on how we're viewing each application requirement. So leadership has decided to not require that for fall 2021. In lieu of that, though, we have this new quantitative experiences statement where we're asking applicants to do a couple things. We want you to summarize the strength of your quantitative and analytical skills by 1, referencing your grades and key math and science related coursework. And then 2, discussing specific details of any research or work experience that involved quantitative and analytical tasks. So again, that one's on the website too. So please feel free to take a look at that for guidance as well. We also require 3 letters of recommendation. With that being said, there's a new piece that the school put out that speaks to some advice for letters of recommendation. So we'll put that in the chat as well. Ideally, we're looking for people who can speak to you being academically successful in graduate school. We definitely encourage you to adequately prepare your references, take the time to set them up for success, and of course, give them ample time to complete what you're asking them to do as well. So just a couple of examples of who you might ask. Someone who knows your academic capabilities, as I said. Ideally, that would be a professor, a boss or a coach, a mentor, an academic advisor. Someone within that realm would certainly be appropriate. We ask that letters are on letterhead and that professional titles as well as contact information of your references are also used as well. So this next slide really is just to get you thinking a little bit about your background and the types of experiences that you've had. We encourage you, again, to incorporate all of the extracurricular activities you've been involved in, including things, and these are just to kind of give you an example, research, professional experience, volunteer work, anything service-oriented. We want to see it. So hopefully this kind of gets you thinking big picture. So I wanted to touch on, before we move away from the application requirements, I wanted to just let you know that we truly look at our complete applications from a holistic perspective. Each application is thoroughly reviewed by not only department staff, but also at least 2 faculty reviewers. All of the application components listed are taken into consideration. There's not one thing that's going to make or break your application. We are looking, again, as you can see, for that total package. As a school, we practice holistic review process when we're making our graduate student admission decisions, and that ensures that there isn't one factor that either excludes or accepts a student from admission. So definitely keep that in mind. So this slide talks a little bit more about our timelines. We are accepting applications for all of our programs right now. Our priority deadline was last week. However, we are still accepting applications. If you are a domestic, or rather an international student, please be aware that our hard deadline is coming up on January 15th. Please be sure to check out our TOEFL and WES requirements as well. But for domestic students, we actually aren't going to be closing until June 15th. So that's something to also keep in mind. If you are interested in one of our MS or PhD programs, again, you can see linked at the bottom there, our push for the Rackham Graduate School website, which has some really important information on it as well. So one of these last slides here touches on funding. We definitely recognize that cost plays a large role in your decision-making process. So first and foremost, we encourage all applicants to apply for FAFSA. You never know what type of aid you will be getting, so we definitely encourage you to take a stab at that. In addition, if you have submitted your application and it was complete by December 1st, you'll be automatically considered for our Dean scholarships. Those are full rides, partial rides, and quarter rides. About 35% of our students receive an award. One thing to note is that you will receive separate communications in regards to an admission decision as well as a Dean scholarship, so keep that in mind. Also, please be aware that we will be corresponding with you via the email address that you used in your application. So be sure to check that email account. You would be surprised how many people we are emailing and they're not receiving or checking that inbox. So please keep that in mind as you go throughout the application process. So at this point, I will pause and I'll let our current student ambassadors introduce themselves. I'll also keep an eye on our chat here to make sure that we're answering all of your questions. Of course, if we don't get to your specific question today, you can always email our team at sph-inquiries@umich.edu. In addition to that, if you aren't following us on social media, I would highly encourage you to do that. We have quite a few current student admissions ambassador Instagram takeovers, Q&As, profiles, and those types of things that are happening in that space right now, and they're always very exciting. So with that, I'll turn it over to some of our current student ambassadors. I'll have them share their name, their department, their year, and from there we'll open it up to Q&A. So whoever would like to start, please feel free.
Hi everyone, I'm Liz. I'm a first year MHSA student here at University of Michigan.
Hi guys, my name is Lexi. I'm a second year in the Health Behavior Health Education department, and I'm also pursuing the social epidemiology certificate.
Hey guys, my name is Mohit. I'm a first year MHSA student, also part of the Global Health Management Policy track. And so I also will be graduating in 2022.
My name is Shanipa, but I go by Amp. I'm a first year student in Master of Public Health in Nutritional Science and Dietetic Concentration.
Awesome. So at this time, we will open it up for questions, as I said. So please feel free to put any questions that you have for our current students or our admissions team in the chat box. As mentioned, we aren't able to obviously answer everyone's specific individualized question. So we'll have our team put in the chat box there, our inquiries email box. Always feel free to reach out to us if you have any questions. Before we look at your specific individual questions, why don't we have our current students go around and share why they chose Michigan Public Health?
I can start. So when I was choosing between which school to attend, I reached out to faculty and students and talked to people in the admissions office a lot and felt really appreciated how responsive they were. I also found myself really interested in like the amount of interdisciplinary and collaboration that's emphasized by the School of Public Health, both within the department and within Michigan as a whole as a university. I think that SPH, and I'm in HBHE specifically, are really encourage students to kind of expand outside. And I appreciated that the curriculum was flexible enough to either do a more practical approach or pursue more research.
Lexi, I had a very similar rationale. I really appreciate how in the MHSA program as well, we have the opportunity and are very encouraged to take different courses from the variety of amazing schools that we have here at U of M. I also went to U of M for undergrad, so a little biased, but we'll definitely echo what Lexi said about reaching out to current students. You can read as much online about a program as you want, but until you really talk with someone one-on-one or in a small group setting, I think that'll give everyone a little better feel for how that might be a good fit for them.
Yeah, I mean, piggybacking off of the other two students, for me, Michigan was basically the best fit. Being able to take classes and being able to connect with people from different schools was a big thing for me. And also gives me like big school like resources, but my cohort or the MHSA isn't a cohort model, so I still get to have like a small like group as well. So it's like a small group, but in like a big school with like all the resources.
I personally was having a little like of a second thought between like choosing the program and the faculties and the advisors, and also as well as current students, like really helped me go through of like what to consider in order to choose and like what resource out there that University of Michigan be able to provide for me. And it basically like really fit my goal, my both like my short-term and long-term goal in order to accomplish that. So yeah, so I appreciate like the very first, like even before I'm like a part of the University of Michigan, they already like really care and actually like hear you out of like what you want and what you want to do.
Great, thank you all. I did see a question here. We have someone logged in who's applying to our executive master's program. So with that being said, we do want a full picture of your academic and professional background. Caitlin Taylor, who works with that program, is most equipped to provide guidance in regards to what we're looking for. So Joyce or Levi, if one of you could put that in the chat box, some contact information, that would be helpful as well. In addition to that, I also just put in the chat box a link to our career outcomes, again, talking about our career services and our support that we have for current students. Within those documents, you can see a breakdown by each department. It includes starting salaries, companies our graduates are working for, and the sectors. So please feel free to take a look at that. In addition, we have very engaged faculty. You'll be assigned with a faculty advisor as a current student. So please feel free to take a look at our faculty as well. Speaking to that, for our current students, could you talk a little bit about your relationship with faculty and how that works in the classroom, of course, virtually right now, but expanding on any of those relationships or anything that you feel like you've learned along the way that would be helpful for this audience?
Yeah, I think in the most formal setting, we are paired with faculty advisors, which can kind of help you navigate different opportunities within the School of Public Health and beyond, as we've all talked ad nauseum about. And I think that's been really helpful because even coming here for undergrad, I still find new things every week that the university sponsors. So it's a great way to have a connection for different programs and also different faculty.
Yeah, I think just adding on to that, a lot of the faculty that I've interacted with have just been very open to, of course, now we're remote, to like emailing and setting up Zoom meetings. There hasn't been, I'm a second year, so I was able to do some in-person learning last year, and it was very easy to just stop folks in the hallway. But very similar, like sending emails and I've usually been able to get Zoom meetings now that we're remote pretty quickly. And it's even with faculty who like I may not be taking a class with.
Yeah, I would agree. I don't know how all of you guys were in undergrad, but I never really utilized office hours with professors. I think office hours, at least during Zoom, they've made it easier for you to access them, and they're quite more flexible in being able to accommodate and figure out times where you can get on one-on-one time with the professor. And I think, like I said, I actually was fortunate enough. I got to work on a conference with a professor at the Ross School of Business in global health. So that was cool. And I haven't really been, and I'm a public health student. So being able to connect with different schools and then also talking to professors from different schools definitely helps with the entire experience.
One thing I want to point out here, up on the screen, you should see some of our admissions team who I've talked about today, as well as some of our department program coordinators. I think I've stressed throughout our short time here that it's a layered approach that we strive for. And in addition to our admissions team, we also encourage you to lean on our department program coordinators who help facilitate the admissions process in the department. So please feel free to take a look at that link and reach out to them within a specific department that you're applying to as well. We definitely encourage you to do that. One other thing, I put in the chat box a link to some of our research centers and initiatives going on, so please feel free to take a look at those as well. I see a couple questions here in regards to previous coursework. So if anyone, one of our current students wouldn't mind speaking to, taking R or SAS or anything like that, I think that would be helpful. And then also any courses that you think specifically helped prepare you for the academics in graduate school.
I had no background in public health. I was a pre-med, so I had no background. I think the class at least that I'm in MHSA, they are introductory classes. So you're not really thrown in the deep end, and your entire cohort is also with you in the same position. So you're not really behind the 8 ball per se. As for some type of like coding or anything like that, I have had like very, very basic like introduction with like Stata, but apart from that, I really haven't had as much. I do recommend though that get used to using Excel. That's something that I've had to work with quite a bit. So getting to know how to use Excel would be very helpful.
Yeah,
I
kind
can
of
get-
echoing that. I see
Go ahead,
even Barbara's post in the chat here. I think I came in with a minimal stats background, just like the introductory one from undergrad, and did not do very well in calc in undergrad, and we're doing just fine. So I think you're okay.
Anything else related to experiences or courses that you took that you thought were helpful?
I can go related to experience. I know like I took a couple of years off before applying to grad school. And my background was also in geography. So it was not very public health based. So I would also just a little voice of like encouragement, like try not to stress too much about your transcript, especially if you're a little further out, but also just like think about the ways that work that you're doing relates. Public health is a really interdisciplinary field. And so there's likely going to be a lot of ways that your experiences do relate to like what you're hoping to do here at Michigan or in your public health career.
So a question here, if you have taken the standardized test or a standardized test and you want to submit your scores, you certainly are able to do that. However, I can tell you that it will not be used when making an admission decision. It would be used to help inform our process for the future. So if you want to talk more about that, Sasha, I'm happy to chat with you offline about that. And if anyone else has specific questions, you're welcome to email me. I'll put my email right in the chat box. I see quite a few questions related to the priority deadline. So just to follow up on that, our priority deadline was December 1st. We utilized that deadline to evaluate students for our scholarships. One thing hopefully that you have found is that your SOFIS application needs to go through a verification process that can take a couple weeks. So with that being said, that's kind of our cutoff for our initial reviews for scholarship consideration. That it doesn't mean necessarily that if you submitted after that, you wouldn't be considered for funding. It just means that it's not guaranteed. So again, now that we're past that December 1st, what you should be keeping in mind is if you're a international applicant, your hard deadline, final deadline is going to be January 15th. So coming up here in about 5 weeks. If you are a domestic student, you will have until June 15th to apply for fall 2021. So if you have additional questions about that, please hesitate to reach out to our team. We are getting a a lot of applications in. Alone last week, we processed over 250. So we are very busy behind the scenes working to get to your emails. So we appreciate your patience and us getting back to you. I know we're a little bit over time. While we close out today's session here, if I could just ask our ambassadors, if you have one piece of advice for our prospective students, what would it be?
I think my advice, I sort of alluded to it a little earlier, would be to just really try to demonstrate your passion within your statement and your personal history statement, because I think a lot of times when you're applying to schools, people tend to get really caught up in numbers and GPA and quantitative experience. But I think also demonstrating that passion through your writing is something that the departments will care heavily about.
This is going to be very cliched, but be yourself. And figure out exactly, I mean, it's too early to know exactly what you want to do, but if you do know, that's great. But try to make sure that wherever you do choose to go to, it's like there's a fit. So the university, the way the program is created and the way the school views something kind of aligns your views in that way. It doesn't have to be that there's like a top school and you want to get in, but your views are completely opposite of each other.
Yeah, kind of echoing what Mohit was saying and some of the things I was mentioning earlier. I think just taking the time to do that self-reflection will really come out in your application materials. And being as honest to yourself and genuine as you can, I think gives you the best shot to find the best fit for you. So good luck, everyone.
Great. Well, thank you all for taking time, especially as you're preparing for exams, to join us this afternoon. And thanks to all the prospective students that joined us. Please continue to lean on us as your support team as you work to complete your application. We are here for you, and we hope that you will reach out to some of these contacts listed on this slide here. So with that, we wish you a great holiday season, and we will be in touch soon. Thank you and have a great day.